Your surgery results are being determined now, and you're probably not even aware that this window is open. Most people assume surgery is where everything happens. You book the procedure, pick the date, show up, the surgeon does their thing, the consultation, just a formality. The operating room is where the magic lives. But that assumption costs people more than anything else in plastic surgery. For over 14 years and over 2,500 procedures, including breast surgery, body contouring, post-weight loss procedures, I've seen this play out time and time again. And for a long time, I made the same mistake. I was dead wrong about where my job actually started. What I figured out has changed every single consultation. The old thinking was that the job began in the operating room. Listen to the patient, assess the anatomy, determine the procedure, execute with precision. The surgery was the work. The problem is that a technically proficient procedure aimed at the wrong problem is going to produce results that don't necessarily connect with the patient. Not because anything went wrong, but because the actual goal was never addressed. The consultation is the procedure. The OR is just where we execute it. Most patients walk into a consultation prepared to be told what to do, not prepared to talk about what it is that they want. The first part of every consultation often starts with questions that patients don't even expect. Like, what does a good outcome look to you a year from now? What do you want to feel when you look in the mirror? Is there a life change tied to this? Those answers often can shape the plan more than the anatomy. When you walk into a consultation, you're not there to be told what you need. You're there to be heard. If the surgeon is doing most of the talking in the first 15 minutes, pay attention to that. The consultation gets you to the right plan, but what you do before the date of that consultation is a completely different variable. It's one that almost nobody talks about. Now let's talk about why operating on an unprepared body is like building on a cracked foundation. Traditionally, people came in ready. I performed the surgery. They were adults. They made the decisions about what they wanted. My job was to deliver to the best possible outcomes. Over the years of follow-ups, however, I noticed there was a clear pattern that emerged. Patients with stable weight, solid muscle foundation, controlled metabolic health had categorically better outcomes from patients who had identical anatomy, but who didn't have the same foundations. Same surgeries, different outcomes. The preparation was the variable between those outcomes. So surgery on an unprepared body is like renovating a house on a cracked foundation. The preparation window is available to almost every patient. A lot of them just don't know that that window is now. So let's give an example. I had a CrossFit gym co-owner, approximately 5'2", 185 pounds. Her A1C, which monitors her blood glucose control, was through the roof. I recommended medical weight loss first prior to any surgical intervention. She wasn't thrilled about the delay. Like most people, we all want immediate gratification. But she followed the plan. She lost 50 pounds, got her diabetes under control, then moved forward with her breast and body procedures. At follow-up, she said she's in the best shape she's been in for years. She had totally renewed confidence. She even was able to have the competence to get a boudoir photo shoot, which is something she said she would have never imagined doing. The key thing to understand is that outcome didn't happen in the operating room. It happened in the months before she ever even got there. So the time between now and your preparation isn't a waiting room, it's active preparation. Having stable weight, building muscle, getting your metabolic health under control, that work ahead of time compounds with surgery in a way that nothing else can. So preparation is one side of it, but understanding what surgery can and can't deliver is really a critical component. And that's where most people get the map entirely wrong. Hey, if you're liking this content, hit thumbs up or subscribe. These videos are built to give you something that can actually change how you go into your consultations and can directly affect what outcomes you may have. We put these out on a weekly basis and hope to keep bringing you great informative content. So let's talk about the one thing that every patient with life-changing, transformative results has in common. So looking back at patients whose outcomes genuinely changed someone's relationship with themselves, there's always a pattern. These patients were never passive. They asked better questions, followed preoperative guidelines and recommendations because they understood why, not because they were just being told what to do. They communicated clearly and they were prepared when they came into their operations. So this is evident and visible in the consultation. Patients come in prepared, asking about outcomes, not just about the procedures. They're curious about what they can do to prepare and have their best outcomes. Are they coming in prepared with questions, or are they just passively waiting and being told what to do? So it's important to understand that a surgeon can only work with what's in front of them. A patient who's prepared physically and mentally gives their surgeon a fundamentally better canvas to work with. The ceiling for what a surgery can do for you is partially determined by how much you show up for the process. Now, the thing that I got wrong for years, because it connects directly to what separates patients in the first category from everyone else. Let's talk about the weight loss tool that I was wrong about for years and why I changed my mind. In the past, we often thought using weight loss medications was an easy way out, a shortcut. Honestly, I probably held that view without really questioning it. But then I realized nobody questions or judges patients for being on blood pressure medications, diabetes medications, cholesterol medications. But there's a stigma that seems to surround GLP medications. And it's not based on physiology. It's based on a lot of outdated assumptions about weight that really have no business in the medical conversation. And what I often tell patients is we see that when a lot of patients are able to get their weight under control, they get off of a lot of these other medications that are being caused by this underlying pro-inflammatory state of having this visceral fat. The key is not that these medications are good or bad, it's how they're used. So up to 50% of the weight loss that people can have in an unmonitored plan can be muscle mass loss. And that's not a win. Muscle mass and strength are among the strongest predictors of longevity. Patients who end up losing significant amount of muscle decrease their metabolic rate, make it harder to lose weight, become weaker, and will regain even more weight if they come off the medications. And they really haven't done themselves any favors. So one of the things that changed wasn't just watching the success that people can have on these medications, but seeing what can happen to patients when they take them in an unmonitored fashion and without proper support. It's important that if you're on these medications, you have a proper protocol and monitoring to make sure that you're doing it in a healthy and effective way. So at our practice here, some of the key things we do is body scans before starting the medication, so we know exactly how much muscle mass, how much under the skin or subcutaneous fat, how much visceral fat a patient has, what's that lean mass. We also incorporate resistance training recommendations, protein recommendations so that you can maintain that lean mass. And we slowly taper the medications up. The goal is not to completely suppress appetite so that people starve themselves. It's just to control the appetite so you eat slightly less. The goal is fat loss, not weight loss. But if you're not monitoring and you don't know what you're losing, you may be losing more muscle mass and not as much fat as you would like. The key target is that visceral fat. The difference is the visceral fat is very pro-inflammatory and leads to so many health complications like diabetes, high blood pressure, heart disease, high cholesterol, cancers. That is the key target. It's not about moving the number on the scale. So if surgery is being considered, but your weight and metabolic health is still a factor that needs to be controlled, that's a conversation you need to have with your surgeon. The surgeon who's willing to have that and willing to delay your surgery to get those things under control is thinking about your well-being and your outcomes first and foremost. All of that is about optimizing your results and making surgery better when surgery is going to be the right answer. This last piece is about knowing what surgery can and can't address. And it may be one of the most important things that you need to think about before having a procedure. Everything so far has been about making surgery better when surgery is the answer. This is about knowing what surgery is not able to address. First, it's very important, I think, for people to remove any shame about having cosmetic procedures. It's not a vain choice, and you shouldn't feel shame about pursuing procedures as long as they're safe and they make you feel better. The important thing, though, is it's true that surgery will change what you see in the mirror, but it's not going to change what you think about yourself when you see it. So these are two different things. Surgery can only reach one of them. Patients who are struggling with issues outside of the issues in their tissues, maybe it's an unresolved relationship, recent divorce, anxiety, depression, using surgery to signal a change they haven't actually committed to yet. They'll get through the surgery and the recovery, but often they're going to find that the surgery didn't provide the actual results that they were looking for. And it's not because anything went wrong, it's because the problem was never in the tissue. The most transformed patients are already on a trajectory. They feel good about where they're going, and surgery is an accelerant on that momentum. That's the CrossFit patient example. That's what 14 years of experience teaches you to look for. So tonight, ask yourself these 3 questions. Number 1, can you describe what you want to feel, not just look like, 12 months after surgery? And give it 5 real minutes to think about. Number 2, is there anything in your metabolic health, your weight, or your fitness that you know you really need to address before doing surgery? Answer this honestly for yourself. Number 3, is the thing that you're hoping surgery changes actually a physical thing? Or is there something underneath it that surgery isn't going to be able to fix? There's no wrong answer here, but there's a more honest one, and finding it before surgery will shape the outcomes you have afterwards, way more than any surgical technique. 14 years in this has taught me that the most important work in plastic surgery happens before any incision. Patients who come in prepared, who've addressed their health, who know what they want and how they want to feel after surgery, those patients get results that genuinely change them and are transformative. Hey, we've got videos already on this channel that go deeper on what most surgeons won't tell you before you booked. It's called 5 Things Your Plastic Surgeon Isn't Telling You. Every point connects to topics we've just covered. The link's right here.